Thank you for joining us at the 2024 Towards an Anti-Ableist Academy Conference. My name is Pam McGinty, and I am the co-chair for the Council for Disability Concerns. This council started in 2021 to provide updates on the Student Idea Board report implementation. We have come a long way since the report was compiled in 2019, but there is still more work to do. This year's conference has included many great topics that we hope can help advance accessibility and inclusion on our campus. A few announcements before we get started. All the conference sessions will be recorded and posted to the Towards an Anti-Ableist Academy website as soon as possible. All slides and any supplementary materials will be posted in this session's Google Drive. Any participation is completely optional. Chat will be disabled during this presentation to support screen reader access, but feel free to ask the presenters any questions you have during using the Q&A feature. At the end of the session, we will pull any unanswered questions into a separate document and we will answer them following the session. Please be respectful of anyone who you interact with during the session. And now, it is my honor to introduce P.F. Anderson, who will present Disability Culture and Comics, Finding and Telling Our Stories in Our Own Ways.
Thank you all so much for coming today. It's an honor to be here. The image that's on the slide is a watercolor portrait of me that was gifted to me by the comic artist Anita White. And in it, you'll see someone who looks very much like the me in the Zoom little camera thing, where it's a white woman with brown hair that also has blue stripes, wearing, she's wearing a blue jacket and a Magen David necklace in the portrait, and I'm wearing a black jacket and a Magen David necklace today. I am also, because it's Halloween, someone asked me to wear a costume. My costume is I'm a time traveler. I'm wearing a Disabled People for Warren t-shirt from a previous historic election. So next slide. Welcome to all of you. This is an image from my friend Rachel, who goes as Rachel DL, and it talks about being welcome to the disabled community. I want to invite you, if you are a person with disabilities, I hope that throughout this presentation you will see much content that resonates with your personal experiences. Because a variety of disabilities will be presented, there may be experiences that are different as well as those that are familiar. If you are not a person with disabilities, I invite you to listen to some of these stories and imagine what it might be like to be part of the disabled community. Next slide. Access notes. As part of creating access for this talk, we made a copy of it. The links have been posted in chat and in Q&A. There's a short link to the master copy. The alt text, it says on the slide that alt text would be present for the images. Because of a combination of technology and life challenges, alt text is not present for all of the images. It will be added and completed after the talk, and there will be an alt text document with additional resources and links matched to the images on the slides. But that will come later, so if you want that or want to share that later, please stay in touch. Next slide. I'm going to have a few content warnings. We're talking about disability. This is a very visual talk. There's a lot of images. Some of them may be traumatic. Some of them may be triggering. Some may describe traumatic events for other people. it's important to be able to talk about these, but please take care of yourself. Just the whole talk, there is ableism everywhere. There is no way I could do this talk without having representations of ableism. So if you need to take a breath and walk away, take care of yourself, maybe have something comforting nearby, or remember that it's being videotaped, and if it gets to be too much, you can always come back to it later if you want to. The example on the slide is the cover of the book Epileptic. And Epileptic is a book that describes the lived experience of a sibling of a person with severe epilepsy. And it's describing the multiple layers of family trauma associated with severe epilepsy. It is a very traumatic book to read. And the story I want you to remember is I was told once about a child who was diagnosed with epilepsy, and their grandparents wanted to be supportive, and they thought all comic books were for kids. They did not realize this was an adult comic book, and this is what they gave their grandchild. And when I first heard this story, I was like, oof. So if you're giving a book to somebody, read it before you give it to them, just to make sure. And remember that many of the books being described today, if not all, but most, are targeting, they are intended to be read by an adult audience. Next slide. And speaking of an adult audience, when we're talking about disability lived experience, relationships come up. And one of the things that is part of the disability lived experience is that there is a stereotype of disabled people as non-sexual or asexual. And there are some of the books that try to counter that narrative. I put on the slide the logo from the Comics Code Authority, which was a previous set of laws that tried to censor stories that were not centering mainstream power structures before they were published, so censorship. This presentation doesn't do that, but I want to connect in your minds the idea of the Comics Code Authority and censorship and how that served to center existing power structures with the ugly laws in disability, which also centered existing power structures and did so by making it illegal for people with disabilities to be seen in public. And to think of that historic context when you're thinking of the contemporary banned book movement. So just tossing out some thoughts and some trigger warnings and a reminder for self-care. Next slide. People have been doing positionality statements for these, and I wanted to just give a little teeny tiny bit. The bulk of this presentation focuses on other people's stories. And we all come with a lot of different identities. I do identify as a person with disabilities, with long COVID, with a whole bucket full of invisible disabilities. If you haven't encountered the slogan or phrase, Crip Queer Mad or Queer Crip Mad, that's a thing. And people just sort of bundle it all together as we have one label that's sort of the whole experience. I'm all the buckets. The image on the slide is my first comic, which is describing a long COVID experience where I was part of a research study for long COVID and I was going to get a blood draw. And all I had to do was walk a block to the bus stop, go to the clinic, get the blood drawn, come back, and walk a block home. And I couldn't do it. A block away from the house, I I couldn't walk any further. I was done. So that's the gist of that comic. I have done more diary comics since then. They won't show up much here. Next slide. I'm going to tell you a story. Stories come in many shapes and sizes, even if they're comics. The image on the far left is a postcard that tells a long COVID story. The image in the middle is a zine, an 8-page zine that is a deaf comic made by a dean, and my brain is frittering around the edges. I have forgotten her last name, but it's in the alt text, or will be in the alt text, and it's called Survival ASL. And it's a little quick reference that you can tuck in your pocket when you are communicating with people who are deaf. And then the third image is a whole pile of comic books about disability, ranging from very, very fat ones to super skinny zines that are maybe 16 or 32 pages long. And the alt text has a list of the whole thing. Next slide. The stories come in lots of sizes, so do the people who tell the stories. And the images show the covers of 3 books. The first one, in Clothes Called Fat, is about a person with an eating disorder. The middle one, called Kid Gloves, is about a pregnancy experience that is pretty traumatic, and you can just, it looks really cute and adorable, but the story's kind of rough. And the third one is The Inflatable Woman, which is a person of size with breast cancer telling their breast cancer experience, but the experience of breast cancer is intertwined with falling in love. So there's a whole range of stories here. Next slide. Stories for all ages. The image on the left is a snippet from a student project from the University of British Columbia, where they had a series of student comics created to help tell the stories and perspectives of families with nonverbal children who need to have some sort of medical experience done under anesthesia and how those are handled. And the project is organized by Dr. Bizney. Oh, shoot. Okay, my brain's frittering around the edges. Dr. Biz is an alumni of the University of Michigan. I attended a lot of her workshops when she was a grad student here. She founded the Transnational Comics Initiative here at the University of Michigan. And it's wonderful to see that connection and that expertise moving on. This particular story is about Sammy, a little girl who loves the cartoon Bluey, and who uses assistive technology for communication. The top of the middle is an image of the cover of Raina Telgemeier's Ghosts, which is a story about cystic fibrosis. This story has had mixed reaction because it gets bonus points for representation, but at the same time, there are concerns about how it represents Native American experience related to spirit life. And there has been pushback from the Native American community. So you can be doing something good and telling a story that needs to be told, but do so in a way that's problematic for some communities and beneficial for other communities. Can't We Talk About Something More Pleasant is by Roz Chast and tells the story of her parents aging and not wanting to talk about getting ready for death and dying. And the story is an interesting approach to intersectional, well, not intersectional disability, competing disabilities, where one of her parents has a cognitive disability and the other parent develops physical disabilities. And together they are able to take care of each other. But as soon as something happens that makes one of them unable to support the other, it all kind of falls apart. And the last image, Bingo Love, is by a disabled creator, T. Franklin, and it's telling the story of two Black girls who were friends when they were young, fell in love when they were teenagers, were separated by their families, and found each other and fell in love again when they were old. So there's just all of these different stories and modes of representation. Next slide. People of all colors. You've already seen some of the diversity of representation. The image on the left is by Lawrence Lindell, and it's his first viral, it's a really famous story called Couldn't Afford Therapy, so I Made This. And the middle image is from a recent graphic novel called Brooms, which is fictional. It's a make-believe about magic and riding brooms. And it has characters who are Black and Native and Hispanic and all these different cultures. And there's people with disabilities, people who are trans, two-spirit, just a lot of different representation in that story. And it's fictional but great fun. The third image is from the book Shadow Life, and it shows a Black doctor talking with an elderly Japanese woman about taking her pills and how she's having problems taking her pills. And she says sometimes she can't find them. And the doctor says, I see. And there's a whole backstory, which this image is all about profound misunderstanding in communications between the two people pictured. But I'll let you read it to find out what those profound misunderstandings are. Next slide. And so many different identities and experiences. I did a really bad thing with the alt text for this, where I actually listed all of the books. I will fix that. I will make it a separate document. But if you search disability graphic novels in Google, it wants to give you over 40 titles. It just goes, here, have some. Next slide. Stories about disability are told by different kinds of people with different perspectives. This image is from the book The Bad Doctor by Ian Williams. And it shows a boy in bed at night thinking how he can rescue his family by doing everything just right. And it has all these thought bubbles as vines crawling out of his head, describing some of the different people and issues and just the thoughts spinning and spinning and spinning. With the words concentration averts disaster. And it turns out that The Bad Doctor is a story about if you are a doctor with OCD, how does that impact on your relationships with your patients, and how do you provide care? Very powerful insights. What about when the doctor or the care provider is the person with the disability? Wonderful, wonderful stories. Next slide. More perspectives, patients and providers and parents. The image on the left is from Side Effects, which is a story describing medication challenges for a young woman in college. And in the scene on the screen, they were taking a medication that caused them to dissociate, but they weren't aware that that was happening. And they just zoned out for class, and they're going, I can't believe I slept through the whole class. The middle image is Psychiatric Tales by Daryl Cunningham, and it contains 11 stories of different types of mental illness in the hospitalization context from the perspective of Daryl's experience as a psych ward nurse. And then the final one is Daryl's experience as an inpatient on his own psych ward. So these are tales of compassion, looking at the experience from both the provider and patient perspective. And then there's so many stories about parents, told by parents. The image on the far right of the screen is A Hole in Beth's Heart. I think that's the title of the book. And the doctor is giving unpleasant news to the parent. No, wait a minute. I flipped that image. This is a more upbeat image than the one I had before. And it's the mother talking with a friend saying, how do you feel about your Downs baby, your disabled baby now? She's going, I love her. I can't help it. It's hard not to. So what changed? It took a while. But when her personality came out, and the book goes into it, the first part of the book's kind of hard, but then it gets into the part where the love happens and there is hope. And these are complex, complicated, nuanced stories. Next slide. And telling stories for different purposes. And there's so many. These are just a couple little examples. So the one on the left is from Alzheimer's by Dana Waldrop. And Dana did collages of her mother's decline and eventual death from dementia. So Alzheimer's, Alzheimer's. And this is just such a tender moment between the two of them. And the image on the right is a visual syllabus, as mentioned by the speaker in the previous talk. This is by Nick Susanis, and it's from his website, and he has many comics syllabi for his comics courses that he teaches. And, you know, he's a faculty member at, is it San Diego State University. And incredible stuff. Next slide. This is a pair of examples from another one of Biz Needham's student projects about anesthesia for nonverbal kids. And these are looking at the same kid, different perspectives. In the first image, you see all of the medical stuff about the kid. And you see this outline, this ghostly outline of a kid in a wheelchair with all these things attached and all these diagnoses. And you see all of the diagnoses, but you don't really see the kid. And then in the second image, you see the kid with his family and his hobbies and his favorite TV shows and his favorite books, and they're a person. And I thought this was such an incredible, dramatic way of putting those contexts side by side for the viewer. It's very powerful. The resources will, in a week or so, have links to all of this stuff. Next slide. And the storytelling and the perspectives are especially important when in a crisis. And these are a few. We've all been through the pandemic. And these are just a few of the things that came out of that. There are books and books collecting COVID comics. The one on the left is from Gemma Correll, and it was published on the Nib. And it's a wry humor. What do I think I'll do during the pandemic or the lockdown and what I'm really doing? And this is a tiny snippet of a much larger piece. And the one on the right is from a collection of comics called In/Vulnerable that was exploring equity disparities during the early part of the pandemic. And in the images here, there's a care provider, a nurse who's doing home care, who has been denied PPE, personal protective equipment, and is calling herself Typhoid Martha, as she cares for these vulnerable patients and doesn't have sufficient protective gear to keep them safe. Next slide. More pandemic. Lawrence Lindell on the left, telling about all of the things he missed out on in life when they were in lockdown. He never got the chance to grieve. He was going to have a wedding, and the wedding, they couldn't have it in person, just all of the things. His book tour was canceled for that viral book. Everyone was so excited, and boom, no book tour. Just all the things. And Rachel DL again on the right, with another piece from, I forget if this one was from her piece for the Nib or her piece for Washington Post, talking about disabled people as collateral damage during the pandemic and emphasizing the relationship and showing a protest for long COVID and ME/CFS in DC. Next slide. So what is a disability? These are all images from Marvel and DC Comics showing superheroes and supervillains who are identified in the canon as people with some sort of disability. We have Daredevil, who's blind. We have Echo, who's deaf. Doc Ock with his assistive technology. Oracle in her wheelchair. And Professor X in his wheelchair. And I don't know about you, but after the sort of things we've been talking about so far in this hour of time on disability comics, this is kind of jarring. It's looking back at what was the representation we had for disabilities before the last 15 years when these types of stories started to come out more. And how has the stories we're told changing? And I look at this, and on the one hand, there's representation and it's wonderful, but on another hand, it's overwhelming and puts a huge burden because we are not superheroes, or hopefully not supervillains either. So I want you to think for a minute about what is a disability. In the discussion document, there's some spaces and placeholders for you to share your thoughts if you want to share them with other people. And I will be really interested to see whatever people are willing to put there to answer some of these questions. Next slide. So thinking a little bit more about where do you draw the line for whether somebody is or is not disabled. And the image on the left, oh shoot, I've forgotten his name. It says it on the bottom, but I can't read it. It's too small for me. What it's like to have your knee replaced. And when you have your knee replaced, the idea is you get better. But before your knee gets replaced, there's a lot of pain, a lot of trouble moving. Are you disabled? is it a disability? Is it a temporary disability? What if the surgery fails? What if it doesn't go right? What if you don't heal well? You know, where does all of this come in? And just thinking about that. In the image on the right by M.K. Chervik, who is with Ian Williams, who did The Bad Doctor, she and Ian are the co-founders of the graphic medicine website and movement. Ian came up with the name, and MK, Ian's in the UK and MK is in the US, and they partnered on getting this all going. And so MK drew this picture, Anatomy of an Artist in Menopause. And there's a lot of things in there about just getting old being challenging and you're changing into somebody you maybe don't recognize. And a few of the things she points out, which you may or may not be able to see in the text, is carpal tunnel in her hands and a wonky knee and chronic plantar fasciitis in one of her feet. And I'm going, would any of us think of any of those as disabilities? And I think it kind of depends. It becomes a question of scale. So carpal tunnel, when it's mild, you can do things. You do the stretches, you do the exercises, you shake your hands out, you warm up before you do stuff, you change how you mouse on your computer and do things and maybe help keep yourself from getting as bad. But if it's severely, it can make it so that you can't really use your hands much at all. Plantar fasciitis, MK is describing 1 foot. But I see MK walking around and I know she's more mobile than I am. And I'm going, well, would you count that as a disability? But then I have a loved one who has severe bilateral plantar fasciitis and they are lame and they are housebound and they can't move. So plantar fasciitis as a diagnosis may or may not be disabling, and where do you draw the line for what isn't a disability? Next slide. AIDS is another one where it's covered as a disability, but people go, is it an illness? Is it a disability if you're being well treated and you're in good shape? Where do you draw the line? And the images on this slide, the one on the left is from M.K. Chervik's book, Taking Turns, about one of the 2 main AIDS wards in Chicago at the peak of the epidemic and starting to treat AIDS patients. And the article in the middle from the AMA Journal of Ethics is by MK and covers a lot of the comics about AIDS and does a deep dive into the comics literature about AIDS and HIV. And the image on the far right, Black Hole by Charles Burns, is interesting because it's written as a commentary on AIDS, but it's a between the lines commentary where AIDS is never mentioned, and it's a metaphor. They use a metaphor of this fictional device. So would you even call that a comic about AIDS? People do, but where do you draw those lines? Next slide. Diabetes is another biggie. Do you consider that a disability or not? The comic on the far left is from a web comic called Miss Diabetes. And this particular image is entitled Doorknobs Are My Nemesis. And the image shows a young woman wearing a crop top with a continuous glucose monitor attached, and the cable is caught on the doorknob and rips it out of her body. And I'm just like, oh, ooh. And I'm sure people with diabetes have experienced this a lot. And Ripple Effects on the right is one of my favorite comics right now. It is written, it's a fictional story about a superhero who develops his superpowers at the same time he develops diabetes. And his superpowers impair the treatment for his disabilities because you can't get a needle through his skin to give him insulin or check his blood sugars. You know, it's like, but the book is a collection in between the chapters of the superhero story, which is fabulous intersectional story. They have little vignettes in text from people with a whole host of different invisible disabilities, and it's just an extraordinary book. I cannot recommend it highly enough. Next slide. Or autism and intellectual and developmental disabilities. Image on the left is another from Invulnerable, a different story about a young woman with intellectual disabilities who was working in a grocery store as an essential worker during the pandemic. And the story is being told by her mother because the young woman caught COVID. The image on the right is about autistic mirroring and masking. And then when two people who are neurodivergent get together and they're both trying to mask each other, and they end up with, wait, who's flying the plane? Next slide. Oh, there's a ton of autism books. Mental illness. I wanted to highlight just a couple. The image on the left is by Ellen Fournay, and it's one of a series of books she's done about lived experience with bipolar. And the glorious little monster Smedmertz is describing her routine for keeping herself in balance. And this routine has worked for her for over 10 years. And so she's sharing it through her comic book with other people. And the book is called Rock Steady. The image on the right is Julia, last name starts with W, and it's in the alt text, and I'll get it in the notes. The book is called Impossible People, and it's a recovery story. And at this image, she's confronting the idea that maybe she's an alcoholic. Next slide. Couple of more on mental health. One on the left is from the book The Third Person by Emma Grove about DID. And right before I started this talk, I could remember what DID stood for, but right now, this minute, I can't. And it's what used to be called multiple personality disorder, but that's not a preferred term anymore. Julia Wirtz, Marriott just dropped into chat. Fabulous artist. And so this is the moment when the character of Emma is discovering that she has multiple personalities, that she has alternate personalities in her. And it's a very confusing moment. The image on the right is from a wonderful artist called Liz Ullman. And Liz writes a great deal about mental health and mental illness. And this is from her profile piece that she has on her blog about some of the ways in which our society makes life harder for people with mental illness. Next slide. And neurodivergence. So which type of neurodivergent are you? From Bez Ollerton. And she has this wonderful book called Sensory about some of the sensory issues and about life with autism. And she was the editor of this comics anthology. And on the right is a new comics anthology that's being kickstarted. They've closed the Kickstarter campaign, so this is still in progress. It's forthcoming, called Unseen, Unheard, and it's about disability and neurodivergence. And I'm really looking forward to getting my hands on that. Next slide. And other invisible conditions. On the left is by Peter Dunlop Scholl from his book My Degeneration about getting diagnosed with Parkinson's. And at the early stages, he can tell that something's wrong, but the people around him can't. And he's frustrated with the changes in himself. And the image on the right is from another webcomic, and it's by Lily Williams, and it's describing what a body feels like with endometriosis. Just, it's everything, it's everywhere. Next slide. And who gets to say they are disabled? So the image on the left is by a student from Michael Green, is a doctor at Pennsylvania State University who teaches graphic medicine courses, and this is by one of his students, first name Kara. The information is in the alt text, and she is telling a long diagnosis story where she's a medical student and she has something wrong with her and she's trying to get diagnosed and keeps feeling like they're playing a broken record, like it's spinning in circles and she's not getting anywhere. And the image on the right is from it's from one of the comics. The public health department at King County in Seattle, Washington State, has an incredible set of public health comics, and this is the first one that they've published on the problem of long COVID. And it's describing a similar situation where the patient is describing their lived experience and the doctor is telling them, don't worry, it's in your head. Next slide. And who gets to say you are disabled? And these two comic styles look very, very similar, but they're very, very different. The one on the left is by Barry Deutsch, who has a Patreon and a web comic and is also a published comic. And it's describing, he has a whole section of his comic site on ableism. And this is one of his from that site. And in this one, there's somebody with chronic pain, a black man coming in with chronic pain who is asking the white doctor for help with managing his chronic pain. And the doctor is telling him that he's drug seeking. And everything he says gets twisted and turned around back on him. And the image on the right is another from Peter Dunlop Scholl's book on Parkinson's, My Degeneration. And in this one, he's talking with the doctor who gave him the diagnosis, and the doctor is trying to help him by telling him information is key. Here's a bunch of information, and he gives him a big box with lots and lots of resources. And he's going, I'm overwhelmed. This is too much. And the the doctor's basically saying you need to become your own expert. And in a sense, this is great. And in another sense, it's pushing the problem off and telling the person to become their own doctor. Next slide. Comics by and for deaf folk. There are so many. I was selective, but you won't believe me because there's just so many. On the left is a snippet from El Defo. And the character is in the hospital and being offered ice cream by the nurse, but can't hear the nurse. And so she doesn't know the nurse is doing anything and she just keeps drawing. But then she sees that all the other kids get ice cream, and how come she never gets ice cream? And nobody realizes that she's deaf now. And the image on the right is from the manga Silent Voice, about a young girl, Shoko Nishimiya, who is deaf and she's a transfer student introducing herself to her new class by taking a notebook and flipping the pages with the words on them to introduce herself. And the rest of the story is several years long interactions between her and the school bully, who eventually becomes bullied himself because he's been so mean to her. Next slide. More comics by deaf folk. A webcomic called That Deaf Guy. And he's telling somebody, wow, your ASL is really good. How did you learn? And they go, did you try this? Nope. This? Nope. This? Nope. So how did you learn? Starbucks. And the other image is just ridiculous silliness, taking the idea of an ASL translator to an extreme. So you have the young man who's deaf sitting in a stall in the bathroom, and the person next to them is knocking on the wall going, there's no toilet paper in here. Could you pass some over? And the ASL translator pops under the door to sign to him that someone's asking him a question, and he shrieks. So a little bit of bizarre humor. And that one is by Calda Tellier, who does a whole series of really fabulous deaf comics, deaf life experience. Next slide. The one on the left is another one by Calda Teller, and it's how to say emotions in Filipino Sign Language. The image in the middle is by another webcomic, and I will get you who the artist is. I'll get that information. And it's a person going to see a doctor, and the doctor says, let's use that notebook approach that the Japanese girl was doing. I'll write things down and you answer. And the deaf person is going, but writing is not my language. ASL is my language. And then in the image on the right, it's an image from the story Brooms that I mentioned before. And in the upper left corner of this image, you'll see a Black Native American girl speaking in Indian Sign Language. Next slide. Comics by and for blind folk. The image on the right is of a blind comics artist, Sabine Rear, who I absolutely adore. I've met her. She's a fabulous, gentle, kind person and does incredible art. And the image on the right is about how do you make comics accessible to people who are blind. Next slide. Oh, and that was from Nick Susanis's website again. Next slide. And there are comic scripts, and this image is talking about the comic script archive as a resource to make access for comics for blind children and teens. Next slide. More about disability culture experience. I'm running over time. I was afraid I would. So just, I'm going to just very lightly skip through some slides at this point. Next slide. Going to work and school, the image on the left is an example of a comics exercise by students in a class, students with disabilities drawing comics about how they've encountered ableism in their college experience. And the image on the right is a middle school graphic novel about kids with disabilities working in a printer shop. Next slide. They have hobbies and interests, and we see adaptive sports here with a kid with intellectual disabilities on the left learning judo and wheelchair basketball on the right in the manga series Real, R-E-A-L, which is a huge series. If you like wheelchair basketball, you might want to just dive into that. Next slide. Date, have sex, babies, friends. A. Andrews' book, Quick and Easy Guide to Sex and Disability. Oh Joy, Sex Joy has several comics on disability. How Autism Affects Affection by Emmett Hobbs is one. The book You Know Sex is intended as a sex ed book for young adults, but has a lot of disability representation in it. Next slide. As the Crow Flies on the left, with a Black queer middle school person befriending a white trans girl and going through summer camp experiences. The middle image is by Lara May and Sylv Taylor and is the cover of the first issue of their book Sex on Wheels. And then and part of the representation for that's important is both Lara May and Sylv began this book as people living with disability. Lara May has the disability represented by the main character in the dark blue t-shirt that says inspiration porn on the cover. And Lara May does all of the artwork for the comics, drawing with a pen in his mouth. And to see these stories told from the inside, from people with lived experience, is a very powerful and important part of disability comics. The image on the right is from Al Davidson, his book Spiral Cage, and is describing that he didn't have sex until he was 29 because people assumed he was too disabled to have sex. And then he met his wife. And he goes into a long rave about how incredible and wonderful his wife was and says it was worth waiting for. So something hopeful there, to have hopeful stories along with the stories that reflect both positive and negative lived experiences. Next slide. Oh, typo. Oh, they hope and grieve. Hope is some treatments that people help from the long COVID comic I mentioned before. And on the right is by Sarah Leavitt. Sarah Leavitt's new book, Something Not Nothing, about the loss of her wife, her wife was a person with many of the same disabilities I have. And in this shot, Sarah is describing one of the comics assignments she gives to her students and how she asks her students to do it and then doing her own assignment and how this allows her to tell her story of grieving. Next slide. What is disability culture? Common definition. I hope you've seen a lot of that shown in the slides today. Next slide. I'm going to just skip this one. Next slide. Next slide. Affirming experience, more webcomics, and the brittle joints from Maria Sweeney. The one in the middle is another college experience where somebody's in a class with um, their support dog, and they are a person with diabetes, and the TA tells them to make their dog be quiet, and the dog is trying to save her life. So one of the things I liked about this group of three is that each of the people with disabilities is standing up for themselves and not putting up with the ableism that they've encountered in life. Next slide. I have too much to say about this, so I'm not going to do it right now because we're late. Next slide. So quick quote, couldn't afford therapy. He did a second volume because he still couldn't afford therapy. Why is it important for us and you to tell your stories and our stories? Next slide. And this is from an event that happened last Saturday for publishers who are publishing these types of stories, saying, please, we have publishers who are publishing these. Next slide. And that's the end. I'm sorry I ran over. Do we have time for any questions?
Hi, everyone. This is Mallory. I'm assisting today with the question and answer portion of the session. Pia, thank you so much for the fantastic presentation and the great descriptions of all these visual references we're seeing and learning and experiencing. We have a few minutes, and so if folks have questions, you can put those into the Q&A feature so that we can maybe have a little bit more extended dialogue before the end of our session.
It was a lot. I mean, there's just so much in there, and this was just the tip of the iceberg. So one of the things I put in the discussion document is that I'm willing to arrange petting zoos if people want to come visit the books or things like that.
Lovely, thank you. A few folks have just written into the Q&A. Thank you for the eye-opening presentation. Thank you for kind of sharing some of the references that you had included earlier, that others had experienced these different, populations and classes, and they were really well received. One question about any comic books that you're looking forward to being published soon. What's kind of on your radar?
I mentioned one. I track Kickstarter and Etsy for a lot of these, and that's where I'm finding a lot of them. I also follow many of the presenters on Instagram because Instagram has a lot of comics presenters there. And so I find many of the things that are forthcoming there. And for many of the web comics, there's some tools. There's in the resources, oh shoot. So in the slides, past the end of the slides, there was more content that I couldn't fit in that includes some of the finding aids and the include some ideas for assignments, that there's a syllabus directory, there's a syllabus archive for graphic medicine that is available at the graphic medicine website, and the resource section has links to that. There's a disabled cartoonists database. The same person who does the disabled cartoonist database also has a queer cartoonist and cartoonists of color databases, and there's also an eco-comics database. So I have collections of these resources and will try to add more of that into the resource document that I will complete after the talk.
One other person had just asked about rubrics, and so it sounds like there will be a lot more coming in kind of a resource document that will be kind of shared out. So thank you.
I was thinking that for the rubrics in the syllabus, that what I would, that really should be a whole separate presentation on its own.
Well, thank you very much, PF. We very much appreciate the time. We're at time, it looks like, and there are no further questions in the